When you hear the words breast cancer, what's the first thing that comes to mind? A lump, right? For decades, we've been taught to check for a lump. It's the most well-known sign of the disease. But for about 1 in 6 people diagnosed, a lump isn't the first sign. Some of the most important early indicators are subtle and easy to miss. Skin changes, nipple shifts, or even slight swelling could be trying to tell you something. That's why today we're moving beyond the lump and learning how to spot the lesser-known symptoms early. I'm John, and as someone who works in oncology care, I've seen how much early awareness can change lives. Let's talk about what your body might be trying to say and how to listen. Section 1. Why we miss the early signs. The check for a lump message has done a lot of good. It's simple, memorable, and it's saved lives. But it's also created a blind spot. Many people ignore other changes, like a slight skin indentation or a new rash, because they don't match the image we've been taught to expect. And that delay can matter. Research shows that symptoms unrelated to a lump are often linked to longer delays in diagnosis. It's important to remember, most breast changes are not cancer. They can happen due to hormones, weight changes, or age. This isn't about causing fear. It's about feeling informed enough to recognize what's normal for you and what might need a closer look. Section 2. Skin signs you shouldn't ignore. Start with the surface. Dimpling or puckering, like a small dent when you raise your arm. This could be a sign that tissue beneath is being pulled. Peau d'orange, orange peel skin, a thick, bumpy skin texture that might also feel swollen. This is linked to rare types of breast cancer and should be checked quickly. Redness, warmth, or a rash. If it lingers and doesn't respond to basic care, get it evaluated, especially if it's accompanied by swelling. Thickening of tissue. Not a lump, but an area that feels firmer or different than the surrounding tissue. This can be an early sign of less common breast cancer types. Section 3. What the nipple can reveal. Nipples can signal important changes. Inversion or retraction. A nipple that pulls inward or changes direction from how it's always been is worth investigating. Unusual discharge. Any discharge that isn't breast milk, especially if it's bloody or happens without squeezing, should be brought to a doctor's attention. Persistent rash or dryness. If creams don't help and the area becomes scaly or itchy, it could be linked to a rare condition called Paget's disease and deserves a medical check. Section 4. Size, shape, and swelling. Look beyond surface signs. Asymmetry, a noticeable new change in the size or shape of just one breast, can be a flag. Swollen lymph nodes. Tenderness or swelling in the armpit or collarbone may be an early indicator that something's shifted internally. General breast swelling, especially when not related to your cycle. A heavy or tight sensation in one breast could be a response to internal changes. Section 5. From self-exam to self-awareness. Rather than sticking to a rigid monthly breast exam, experts now promote breast self-awareness. This just means paying attention, knowing what's normal for your body and noticing what's new. Whether you're in the shower or getting dressed, take a few seconds now and then to observe and feel for changes. There's no one right way to do this. What matters is consistency and curiosity. If there's one thing to remember, a lump isn't the only sign. Your body has many ways to get your attention, and being informed gives you the confidence to take action. If you ever notice a new, persistent change, whether it's a skin texture, nipple shift, or subtle swelling, don't panic. Reach out to your doctor, get it checked, and take that step toward clarity. Most changes turn out to be harmless. But on the chance that it's something more, early detection and working with your healthcare provider make a huge difference in outcomes. If you found this helpful, please consider sharing this video. The more we talk about breast health, the less fear and silence there is around it. Thank you for watching. Know your body. Trust your instincts. You are your best advocate.